Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with an October 8th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. Dubuque County added 61 cases today, making the total 3,907, which is 404 new COVID-19 cases since last Thursday. I'm sad to report 4 additional deaths this week, so the total number of COVID-19 deaths is 47 in Dubuque County. 27 Dubuque County individuals are currently hospitalized here. Yesterday's hospitalization number was a 29, a record high for Dubuque County. The 14-day average positivity rate is 14%, which is down slightly from 15% 1 week ago. The age group with the highest number of positive cases continues to be the 19 to 24-year-old age group, with 21% of the cases. The state added 6,020 cases since last Thursday, October 1st. As of October 8th, 2020 at 2 p.m., Iowa has a total of 96,030 positive cases. 11% of Iowans tested have been positive overall. The state 14-day average positivity rate is just around 8%. Deaths reported in the state total 1,420 Iowans. And currently, 449 cases are hospitalized throughout the state, which is the most at one time since this pandemic began. Not the kind of high record we want to see. Finally, about 77% of Iowans have recovered. Last week, Governor Reynolds issued new guidelines for when to quarantine and stated that outside of healthcare and residential settings, quarantine is no longer required if a potential exposure occurs while both the infectious or positive COVID-19 individual and the close contacts are wearing face coverings consistently and correctly. However, some schools, workplaces, and other organizations and institutions are opting not to utilize this guidance and utilize the previous guidance of exposure occurring regardless of mask use, while others are opting to put this new guidance in place. Whatever guidance you are under or choose to follow, remember this: masks do not provide 100% protection. They can reduce the amount of virus transmitted from droplet spread, but they do not provide total protection, nor do they protect against certain types of airborne or respiratory spread. CDC released information this week about the growing body of evidence that supports airborne transmission, meaning respiratory droplets that are produced during exhalation, such as breathing, speaking, singing, coughing, and sneezing, and span a lot of different sizes. But they really fall into 2 basic categories based on how long they remain suspended in the air. There are larger droplets, usually the kind that are visible and that fall out of the air rapidly within seconds to minutes while close to the source or person doing the coughing, sneezing, or talking. And then there's smaller droplets and particles formed when small droplets dry very quickly in the airstream, which can then remain suspended for many minutes to hours and travel far from the source person on air currents. As respiratory droplets are exhaled and moved outward from the person, their concentration decreases from fallout from the air, largest droplets first, then smaller later. So this airborne transmission or spread is one of the main reasons why we're so concerned about indoor air and spending time inside with others at close distances. Related to airborne and droplet transmission is wearing masks. And I want to clarify a misunderstanding that seems to be coming through more often. Masks do not provide 100% protection from contracting the COVID-19 virus. Masks help, but just because you're consistently and correctly wearing a proper mask doesn't mean you still may not become infected. So do not assume what I've been hearing lately, which is, we were both wearing masks, so we're good. Or, I can go into this crowded place or situation because I'm wearing a mask. Please remember, in addition to mask wearing, distancing, adequate air ventilation, hand washing, and proper hygiene are all part of the equation for not contracting SARS-CoV-2 virus. So finally, a few parting thoughts taken from Ernest Shackleton. As we manage our way through continually increasing spread of COVID-19, think about this. A crisis is an opportunity to build resilience. The upside to COVID is that the crisis will only serve to deepen growth DNA and resilience, thereby making us better leaders and more able to thrive and bring our teams, companies, families, communities, and nation through challenges in an increasingly volatile world. Thanks for tuning in today. Have a great warm fall weekend, hopefully enjoying the outdoors and in a COVID-19 safe way, because we're all in this together.